All right, so we're going to go ahead and get started here. We're going to be talking about the GI map test tonight. We're going to be looking at a case study of one of my recent patients, and we're going to be talking about how the GI map test is utilized. What is it that the GI map test is able to? All right, let's see here. All right, okay, we're going to go ahead and get started here. Thank you, everybody, for being here. Happy Tuesday to you guys. Today, we are going to be talking about the GI map test, and specifically, we're going to be talking about what does it look at, what is it used for, how does it help doctors to um, organize a treatment plan or a protocol for you guys based on the testing, okay? And so we're going to be looking at this a little bit detailed, and I'm going to open it up for questions when we're all done, alrighty? So, uh, moving on here, what is a GI map test? So the GI map test is a specialized test to look at the gut. It looks at the microscopic organisms, things like bacteria, parasites, viruses, and fungus, which can be things like yeast. It really helps doctors to understand the digestive issues that are going on in your gut. And it enables a personalized treatment plan. And how does it do that? So the GI map itself is looking at DNA microbes, and it's utilizing the DNA to give us a better analysis of the volume of growth and also very specific health markers that we use for the gut itself. Okay, so how does the test work? Essentially, myself as a provider, as a doctor, I submit an order to the lab. They mail you out a kit to your house. It usually takes about 2 to 3 days for it to get to the patient. At that point, there's instructions inside the kit that comes in the mail. It tells you how to collect the sample, which is essentially a small little container that you then provide your stool sample. You take a little bit of the stool, stick it in this medicine cup, and send it off to the lab. There's a self-addressed stamped envelope in there, usually goes back FedEx or UPS, and that gets sent back to the lab. Um, and then usually within about 10 to 14 days of the lab getting the results getting the stool sample, the results are then sent to myself, and we can then analyze it and go ahead and treat the patient for what's going on. Okay, so let's talk about one of my recent patients. This is a young man named Jacob. He was 14 years old, and his problem was that he came in with 6 months of abdominal pain and diarrhea. Main symptoms worsening after eating, 6 to 8 loose bowel movements or stools per day. When we talked about what was going on in his recent history, it turns out that his history involved a recent camping trip with no other gut issues. Um, Physical exam showed that he had some abdominal tenderness, he had some slight weight loss, and his blood tests really didn't show anything significant other than some inflammation. And when we looked at it, the only thing that they did was to draw a calprotectin. Okay. So that's kind of where we're looking at things. Now, understanding what the test does is really going to be the biggest thing in understanding how to treat a patient. Okay, so one of the things that it does, and I'll show you the difference in some of these testings in just a second here, but the GI map is really looking at the bad germs in your gut, and it's also looking at the good germs. Some of those bad germs, it really we're looking at about 60 different pathogenic bacteria, viruses, fungus, parasites. Some of the few that you might have heard of is things like Clostridium difficile, which can cause severe diarrhea and inflammation. It's one of the superbugs that's out there right now. A lot of times you'll hear it referred to as C. diff. Then you have Blastocystis hominis, which is a parasite, causes a lot of bloating and cramping. You have Helicobacter pylori, which is H. pylori. A lot of people hear about that when it comes to gastric or stomach ulcers and inflammation. And then you have Campylobacter, which is one of the bugs that causes like the stomach flu. Some of the good bacteria that it's checking on, we have about 15 of these guys that it's really checking on to see what the commensal bacteria looks like. These are the healthy guys that you want to be really well balanced. Things like Lactobacillus, Bifidobacterium, those are some that you've heard of before. A little lesser known, but still super important bacteria is Akkermansia muciniphila. That is one that helps to maintain the gut lining, so protects you from irritable bowel, leaky gut. And then you have Faecalibacterium prausnitzii, which is really there to help reduce a lot of the gut inflammation. Now, some of the things that we look at in this test is we're also looking at markers like lactoferrin or calprotectin, which help us to identify the amount of inflammation that's in your gut. We also have different markers that tell us how well you're digesting food. Things like elastase, which is the main digestive enzyme from your pancreas, and you have beta glucuronidase, which is one of the main detoxification type chemicals. When it's elevated, we know you're having problems with detoxification, with exogenous estrogens. And so those are a couple of different markers that tell us how well you're digesting food. And then one of the big ones that tells us how well your body is really protected in this whole process is something called secretory IgA. And this is an antibody that your body makes in the process of protecting you or activation of your immune system. When it's elevated, we know that this is an acute phase reaction. If it's suppressed, we know that this is a chronic thing that's been going on for a long time, and that immune response has been suppressed a little bit, or it's been fatigued, and that's why it's low. Okay, now here's a difference in a couple of the tests. So when I was talking to Jacob for the first time, he showed up with this calprotectin level, what we can see over here on the right. Calprotectin level, again, is an inflammatory marker. So the doc was good in actually identifying that they had an elevated calprotectin. This isn't his lab specifically. This is just a random one I pulled off as a picture, but his was elevated as well. And a lot of times when you're doing some of these tests, your doctors will do a gut test of some kind. Calprotectin is one of the ones that they do quite often. But in order to look for different pathogens, they have to order an individual test. There really isn't testing to do as broad spectrum as we do with the comprehensive stool analysis like the GI map or something called a CSAP, which is a comprehensive stool analysis and parasitology. But if you look at the two pictures on the left side of your screen, you're going to see a couple of the different pages that we actually get from the GI map results. And so you can see there's a lot of different things. So pathogens, the picture on the right, you can see there's 20 different pathogens sitting there. Those are some of the big bad ones we look at. On the middle picture, there's results of H. pylori. And then immediately below that, you can see some of the graphs that we see when it comes to commensal bacteria. Those are the good bacteria that we see regarding your stool. And so we can see how well they're growing, if they're deficient, if they're overgrown, and where on the scale that falls. It gives us a very clear, easy picture to know how to respond to different stuff based on what your results say. Okay. And then looking at the data specifically to Jacob, you can see that we found that C. diff was detected. We saw that the microorganisms were 4.2 million, which was very far overgrown from what it should have been. So his opportunistic bacteria was way overgrown. And that's most likely because the C. diff threw off his commensal bacteria, threw off all the good guys. And so the back guys had the opportunity to grow and cause even more problems. And so he felt severe cramping. Again, he had those 6 to 8 bowel movements a day. And then he had those symptoms present for 6 months. And then he had an elevated calprotectin level. We talked about that. And really, that calprotectin should be under 120, and his is 4 times that, right? Secretory IgA was super low, which means this has been going on for a long time. And we typically start to see that fatigue type change from the elevated IgA to the lower IgA response after probably about 2 to 3 months, depending on your own immune system. So it threw up a bunch of warning flags as to what needed to get done. And so his test results really did correlate with the symptoms he was having. His high C. diff explained the diarrhea and the pain. His inflammation markers confirmed that he had damage to his gut. And so it really helps to guide the doctor using this kind of test on what kind of protocols we should use to help eliminate the pathogen, whether it's herbs, probiotics, different supplements. And then we could also do follow-up testing to make sure that we're truly addressing the root cause of his treatment. All righty. Any questions on that at all? I'm going to go ahead. So this is really, the GI map is one of the frontline tests that we use when it comes to irritable bowel, when it comes to any kind of gut problem, because the majority of your immune system is really found in your gut. And so if, because that's where you interact with the world, about 90% of your interaction is what you put into your body, right? Rather than just the skin and what you're absorbing or what you're breathing. Your gut is really the main source. And so starting there and making sure that the gut is really well balanced and doing well is one of the biggest things that we like to pay attention to when we are uh, addressing somebody's illness, especially if they are having problems uh, from the get-go with an irritable bowel type symptom. So I'm going to go ahead. I'm going to open it up to Q&A here. If you have any questions, I'd love to hear them, love to address them, and we can get you feeling better soon here.